Welcome, everybody, to the Liberty Report. I am your host, Alex Newman. Thank you so much for joining us, folks. If you've been paying any attention to the news, you have no doubt heard that there is a measles crisis centered on Texas. It seems to come around every couple of years or so. There's a measles crisis, and then everybody finds out that a lot of the people suffering from the measles were vaccinated, and the crisis gets swept under the rug. Well, today we have a very, very special guest joining us to talk about this. In fact, I can't think of anybody better or more qualified to talk about this than our guest. His name is Dr. Brian Hooker. He is the Chief Scientific Officer at Children's Health Defense, wonderful organization working to protect the health of our children, which you would hope would transcend party lines and ideologies. We all want our kids to be healthy, I hope. So Brian's got a PhD. He is, as I mentioned, a former professor of biology, professor emeritus at Simpson University. He has dedicated 15 years of his life, over 15 years of his life, to serving as a bioengineer. He has worked with multiple federal agencies and departments. He's also got an incredible book out. If you haven't read it yet, I cannot recommend it highly enough. It's called Vax-Unvax, Let the Science Speak. He co-wrote that with the great Robert F. Kennedy. Brian, thank you so much for joining us today. It's a great honor to have you back on the program. Let's start with the measles. How concerned should we be about the hysteria that we're reading and we're seeing about measles in Texas?
I really, regarding measles, the infection, I really would not be concerned about it whatsoever. I mean, what we're seeing this year is very, very similar to the number of measles cases that we've seen every year. Last year, there were 16 different outbreaks of measles. The MMR does not really provide full protection against measles. So, they've talked about this, the CDC in the past has talked about trying to eradicate measles. But given the fact that children that get one MMR vaccine really only have 93% effective immunity against the measles. This is not something that we're going to see go away. It's not going to be eradicated. And then measles itself, as an infection, the data, the information regarding mortality, the most reliable information prior to the vaccine being introduced in 1961, showed that the mortality on a case basis per case is about two children per 10,000 cases of measles. So there's a lot of inflating of those statistics that are going right now, and it's creating hysteria, it's creating a scare, and it really should not be, Alex.
Yeah, it's interesting you say that. I look back at some of the old TV programs, the Brady Bunch, and they say, "Oh, the measles. Oh, thank goodness, it's nothing serious." Right? And Robert F. Kennedy just had an op-ed in Fox News. He got a lot of pushback on that, but he had some startling information in there that I think most Americans had never been exposed to, like the fact that 98% of the mortality from measles have been totally eradicated before there was ever a measles vaccine. And I think that was news to a lot of people. Continuing on this thing with the measles, you mentioned that the vaccine did not always protect from the measles, and that the disease is not nearly as serious as some of the media propagandists would want us to believe. Why do you suppose we're seeing this crazy hysteria about it, like the sky is falling from some of these media outlets?
I think that it's very, very selective to coincide with the approval of the confirmation of Robert F. Kennedy Jr. as HHS Secretary. It's almost like there's a synthetic effort to create this sort of self-fulfilling prophecy of, oh no, we have this supposedly rabid anti-vaxxer as the HHS secretary, and now measles is going to eradicate the universe. It's very much planned, and it is extremely unfortunate, given the press coverage of this community in Gaines County, Texas, that they've done this. And again, there are so many questions that are not really being answered regarding the measles cluster in Gaines County, Texas. Regarding, and there's so much misinformation out there that's really fear tactics regarding, vaccinate, 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 and there is no other solution to the measles. And to me, in a lot of ways, it's reminiscent of what they did with COVID-19.
Yep. It sure has that feeling, right? Just brainless fear mongering, no real substance, no real solutions. And I do have to wonder personally whether the massive advertising that comes from the pharmaceutical industry helps color the coverage at all. And I don't know for sure that it does, but I have my suspicions. Brian, before we move to another topic, you guys at Children's Health Defense, you guys have an excellent resource. It's called the Measles Book. 35 secrets the government and the media aren't telling you about measles and the measles vaccine. That's available right there on children'shealthdefense.org. Tell the folks a little bit about this resource, what they can learn from it, and how they might put it to good use.
This has many, many facts and figures regarding measles infection, regarding the MMR vaccination, and it really shows, even some of the statistics that you've quoted here, the reduction of mortality in measles prior to the introduction to the vaccination. Also gives some details regarding the vaccination, how it was produced, some of the issues, some of the pitfalls of the vaccination. And now we have the advent of actually a whistleblower from Merck, well, two whistleblowers, Stephen Kraling and Joanne Lokowski. And the book highlights some of the issues with the MMR vaccine, including the overfilling issues, the fact that right now the concentration of virus in the MMR vaccine is much, much higher than anything that's ever been appropriately safety tested.
It's amazing. And folks, I do hope you will get that resource if you're concerned about the measles, if you're concerned about your children. A lot of good information, and you're certainly not going to see it on the front page of your local corporate newspaper. You're certainly not going to watch it on the nightly cable news amid the ads for this vaccine and that medication and all the rest of it. Brian, speaking of whistleblowers, you have some experience in this area. I know you worked with a very significant whistleblower who came out of the CDC, Dr. William Thompson, who exposed massive fraud, massive corruption within the vaccine safety research within the CDC. This led to the release of thousands of pages of documents. Of course, you have personally been affected by some of this dishonesty from the vaccine industry and the government regulators that for a long time appeared to have been working closely with these people. Talk a little bit about that whistleblower, what we found out through his work, Dr. William Thompson, about some of the health risks of these vaccines.
Well, Dr. Thompson contacted me privately in November of 2013 and shared documents with me over a 10-month time period, and then ultimately came forward with the revelation that the MMR was associated with autism rates in African American males, and it was a study that was published in 2004. It's a fraudulent study because they withheld information showing that African American males that got the MMR vaccine on time were actually more than 3.5 times more likely to get an autism diagnosis than those African American males where they merely waited to give the first MMR until after their third birthday. And so this was a really significant revelation. There was also a revelation that individuals that had regressive autism, which accounts for about 80% of all of the autism cases, result from some type of, normal development trajectory followed by a regression. And it showed that those with regressive autism were 2.5 times more likely to have some type of reaction to the MMR when they received it on time. And in other words, regressive autism could have been prevented if they merely had waited until after 3 years of age to give the first MMR vaccine. And so this was, very significant revelation that came out of Dr. Thompson. There was a lot of other information that came out showing that mercury in vaccines that was used as a preservative, still used in vaccines as a preservative to this day in the flu shot, is responsible for tics in boys. And so, these revelations were coming out where the CDC was very opaque. It was very, very locked up. But, the revelations of Dr. William Thompson was showing that, instead of the lockstep CDC, jingoist statement, vaccines don't cause autism, he was showing something very, very different.
Yeah, and that's amazing. And I suspect that that's just the tip of the iceberg. After trying to deal with the CDC and the FDA and HHS and all these agencies surrounding the COVID injection and spending years using FOIA trying to get documents, I suspect there is so much more that we still don't know. Brian, we're going to go to break in just a minute. When we get back on the other side of that break, I want to talk to you a little bit about your incredible book that you did with Robert F. Kennedy, Vax-Unvax, looking at some of the data that exists comparing vaccinated populations with unvaccinated populations. It's absolutely fascinating. But before we get to break, I know you have worked very closely with Robert F. Kennedy over a period of many years. I have thoroughly enjoyed my conversations with him. I think he's just right on the money on so many issues. What's your initial assessment I know he's under attack from all sides, but what's your initial assessment of his tenure so far as head of HHS?
Well, he's only been head of HHS for, 3 and 4 weeks, but so many things have changed. And there is so much of an emphasis of radical transparency. And speaking as someone that, literally, Alex, I file one FOIA a month to the CDC because that's really your limit. You can only file one FOIA request per month. I started doing that in 2004 and I'm still doing it. And so, it's been an agency that, it's taken, a bunch of, axle grease and a crowbar to get very, very few documents out of. And so seeing this era of transparency where they're calling to release large databases, large data sets within the HHS, to shine the light. And also, there was a website that went up that showed all of the different conflicts of interest within the Advisory Committee for Immunization Practices within that membership. And, to see that level of sunlight being shown on these agencies and to see the commitment to look at things like vaccines and autism, to look at food additives, to look at the FDA and the way that the FDA is approving drugs, biologics, as well as food, and overturning some behemoth regulations in the deep state in order to just shine more light on what's going on in the food industry, in the pharmaceutical industry, in the vaccine industry. I couldn't be more happy with what's going on right now in the HHS with Secretary Kennedy.
Yeah, it's really been fascinating. And I always say, as a good rule of thumb, the more the media squeals about something, the more you're on the right track. And there's a lot of squealing going on right now. So that's very encouraging. When we get back, we're going to talk a little bit about Vax-Unvax, what the data shows in terms of vaccinated populations and unvaccinated populations. So, folks, stay with us. We're going to be right back in just a moment after a quick message from our sponsors.
My name is Josh Hewlett. I am Cardio Miracle's Director of Communications and International Relations. We are so excited to be offering Patriot TV viewers a 10% off discount by simply heading to your favorite show host fan page. When people try it, brain fog goes away, better energy, they have a faster recovery, better mood, sharper focus, better sleep. Head to your favorite show host fan page and check it out.
Attention American business owners, big or small, your company deserves to be seen, and Patriot TV is here to help. We're proud to support American-owned businesses by offering a free listing of your company on Patriot TV Store. That's right, no cost, just visibility to millions of loyal viewers who want to support American businesses like yours. Whether you run a small business or a nationwide company, this is your chance to reach a dedicated audience on Patriot TV Store, on major smart TVs like Samsung, LG, Sony, TCL, Roku, also on Apple, Android, Amazon, Fire Stick, YouTube, Facebook, Rumble, Truth Social, X, and of course, the Patriot TV Store app and website. It's our way of giving back to the community and helping American businesses thrive. Let's work together to build a stronger America. Don't miss out on this incredible opportunity. Get your free business listing today. Contact us at info@patriot.tv.
Welcome back to the Liberty Report. I am Alex Newman, your host, and we are here at Patriot TV. Folks, get over to patriot.tv/Newman, patriot.tv/Newman. Become a Patriot Defender member today. You can help support the work we're doing. You're going to get exclusive content and incredible deals on all kinds of stuff. Also, check out our list of sponsors there. I mean, these are great companies bringing you great goods and services. And when you use that promo code Newman, you're going to see nice little discounts there. You help us and the work that we are doing here to get the information out to the American people, and you can help yourself. Now, our guest before we went to break was Dr. Brian Hooker. We're holding him over for another segment, which I know is a little bit unusual, but he's got so much to say. He's got so much insight into these things. And I do believe this is one of the most important issues we are facing today as a society. Brian, thank you for staying over the break with us. I want to turn to the book that you and Robert F. Kennedy did, Vax-Unvax, Let the Science Speak. You guys looked at the data that exists about vaccinated children, vaccinated and unvaccinated populations. And your findings were simply astounding. I think a lot of us suspected this, but it was nice to see it confirmed. Talk to us a little bit about what you guys found here.
Well, looking at vaccinated versus unvaccinated children was probably one of the most astonishing things I've done in my research career. And we found that the rate of neurological conditions, autoimmune conditions, and infectious diseases was much, much higher in the vaccinated portion of our cohort. You know, these children that are unvaccinated, they're having less ear infections, less respiratory infections, less gastrointestinal infections, less autism, less ADD, less ADHD, less tics, less neurodevelopmental delays in general, and then autoimmune conditions, including asthma and diabetes, are much, much lower in the unvaccinated population. I did not expect to see the difference in infections and infectious diseases, but it was not only in the research of people that were looking at the entire vaccination schedule, but looking at individual vaccines, like repeated use of the influenza vaccine that, children and adults are supposed to get every year. They were showing much, much higher rates of hospitalizations for, you guessed it, the flu. And we saw this with the COVID vaccine. The more individuals were being boosted with the COVID shot, there was a study that came out of the Cleveland Clinic, the more likely they were to get a repeated COVID infection. They were getting infected multiple times with the COVID virus. And so, the entire construct regarding vaccination, and especially the very, very bloated vaccination schedule now that is given to children, where they have upwards to 28 needle sticks through their first birthday, through their first year of life, it really made me take pause and think, what are we doing here? Why don't we step back, look at this construct, disassemble it, look at this real data, and see, is vaccination worthwhile? What vaccinations are worthwhile? What have we done with the schedule? And again, nothing really could surpass or trump the health of unvaccinated children and adults.
Yeah, it's so interesting, Brian, to have this confirmed by the data, because anecdotally, that is exactly what I observe. We know a bunch of families that don't vaccinate. We know a bunch of families that vaccinated their first child. First child suffered from catastrophic injuries, all kinds of things, everything from, mental, brain problems to arthritis to autoimmune things. And then they didn't vaccinate any of the younger kids, and all the younger kids are fine. They're healthy as a horse. So something is clearly going on here, and we see it anecdotally. Now we're seeing it in the data. It's to call this troubling would be the understatement of the century. I want to turn in the time that we have left a little bit to the mRNA technology. The COVID thing, as far as I was concerned, the injections were very dangerous. I urged my immediate friends and family who asked my opinion not to do it. We had several people who did anyway and suffered very serious consequences. And I still don't think we've gotten the full truth about this, although little by little, the peer-reviewed literature is catching up with what so many of us saw. But now we're seeing, Brian, efforts to create new mRNA concoctions. In fact, we saw this proposal to have the AI systems come up with personalized mRNA cancer vaccines for every one of us. Personally, I'm a little bit suspicious. I don't want any. Am I wrong to be suspicious? I mean, do they know something that I don't?
I think you need to be very suspicious. I think we have to be extremely cautious with anything that we're doing with, this genetic code, with this nucleic acid content. When I first saw the composition of the Pfizer vaccine and the Moderna vaccine, I thought this looks very, very similar to the technology that, colleagues of mine in graduate school were using in order to stably transform and make genetically modified cells, genetically modified mammalian cells. But yet, Pfizer and Moderna and the FDA were saying, no, that's not going to happen. It's not going to integrate into your genome. But data are bearing out that shows something very, very different. And the more that you interrupt the genetic sequences, the more that you intervene with, key genetic elements, the more that you can promote certain forms of cancer, the more that you can promote autoimmunity and autoimmune disorders. And that's really what we're seeing when we look at the explosion of vaccine injuries and adverse events that are associated with mRNA vaccines. I mean, it's really come to bear out. It's very difficult to find somebody that received an mRNA shot that's doing fine. I mean, so many of them that we're hearing from, the experts, these individuals that are treating, COVID vaccine injuries, we're hearing, that they just can't keep up because so many people in society have been affected and so many people did take the COVID shot in the United States and worldwide.
Yeah, and it's so amazing. Again, anecdotally, we see this. They did some polls. Almost all Americans, it seems like, know somebody who was injured or who they think was injured or killed by these things. And then you start looking at the data and the peer-reviewed literature, and it's starting to come out now that there were some really, really serious problems here. We're down to just a few minutes left, Brian, and I don't want to leave people on a downer. I want to give people information that they can use to make better decisions for themselves. What do you recommend, first of all, to parents out there who may be looking at these issues? They're seeing the propaganda about the measles, or hearing from their doctor that they must take this whole recommended thing. Where should parents be looking for good information on these things? Obviously, your book, Vax-Unvax, is critical information, I believe. But where should people be looking for good information about this? Who should they be talking to, and what should they be thinking about as they try to make these very difficult decisions for their families?
What I recommend is that you take the information like what's in Vax-Unvax. There's another good book that just came out by Dr. Paul Thomas called Vax-Facts that, I think is really comprehensive. And there are other books that have been written in this subject. Neil Miller, who I've published several papers with, wrote a comprehensive book. I think it's Miller's, review of vaccination studies, something like that. And in addition, you can go to children'shealthdefense.org. You can go to the National Vaccine Information Center, nvic.org. You can go to Physicians for Informed Consent. And there are other really, really good websites. But what I would like to see people do is to take this information, even taking the packet insert out of the vaccine itself. If you are making these decisions for your child, for yourself, for other family members, take out the package insert, read it. You can even Google package inserts, and the FDA has all of them. This is an insert of the package of the vaccine vial that shows, collectively, what are the adverse events? What are the ingredients? What are the contraindications of vaccination? Look at those and then have frank discussions with your provider at that particular point in time. Parents are the best experts for the children. Nobody else is, when I was raising my son and still am raising my son, nobody spends 24/7 with them, with those children, except for the parents. And so I think a lot of times parents don't trust their instincts. They're being talked down to by medical practitioners. But I encourage you to do your own research, look at this information, and then present it to your practitioner. And then really trust your own instincts regarding making these decisions for your family. Nobody knows your children better than you. And you should know the contraindications to vaccination, and things that I didn't know. My son was actually vaccinated when he had an active ear infection, and that was cataclysmic for him. But now I know you do not vaccinate a sick child, and neither would, in given my son's case, would I vaccinate him at all. Knowing what I do medically about my son, so I encourage parents, make these decisions take the information in your own hands. If people are saying that you're not smart enough to read it, phooey. Read the information yourselves and get educated.
Yeah, so much good advice there. Thank you, Dr. Hooker, for sharing that. We're down to just 2 minutes, and so beyond just our own children and our own families, I want to ask about the policy level. I mean, how can Americans who are concerned about the health of children, who are concerned about some of what we've seen with regulatory capture, who are concerned about the opaqueness of some of these agencies that ostensibly are supposed to be protecting and serving the public, how do you recommend that they get involved in doing something positive to try to make this country a better place, to try to protect the health of children, generally speaking?
Well, I want to see people communicate with their legislators, both at the, all three, local, state, and federal level, about these issues. People need to be informed. There was a bill in Hawaii, HB 1118, that was going to take away their religious exemption from vaccination. It was going to completely eliminate it. But the constituent outcry, there were over 2,000 letters that were received within a week's period of time in Hawaii, and that bill got pulled because of the action of constituents. So, it's important to be aware. It's important to be informed. There are state chapters of things like Children's Health Defense that people can get involved with that are good information sources. And there are other great medical organizations at the state and at the national level that people can get involved with. And really, you want your legislators to work for you. They need to know that you exist. They need to know that you're concerned about health freedom issues. And it is so encouraging to see people get involved. Even just writing an email, writing a letter, making a phone call, it does make a huge difference.
It really does, and people are intimidated. I often notice about the idea of contacting their legislators. What am I going to say? They're so important. I'm just a nobody. You know what? They're oftentimes very happy to hear from you. They oftentimes don't know the things that you know, and so you can help them. And they're supposed to be representing you, right? So we need to remember they actually work for us. They're supposed to be representing us. How can they represent us properly if they don't know what we think and what we want? Dr. Brian Hooker, it's always such a pleasure to be able to speak with you. It's so refreshing to have just this honest dialogue about these things that we're not supposed to be talking about, but that we need to be talking about. The website again, Children's Health Defense, the book, Vax-Unvax. It's available anywhere good books are sold. And you, sir, are on social media, I believe. People can follow you on X. What's the best way if people want to just stay on top of the great stuff you're putting out?
It's at Brian Hooker, PhD. On X, and then I think I'm still on Instagram. With Meta, it's always dicey. And I think I'm at Dr. Brian Hooker on Instagram, or you can just search for Brian Hooker, PhD, or Dr. Brian Hooker on Facebook. Please follow me. Please follow Children's Health Defense. Thank you, Alex, for, you're doing God's work in getting this information out. I'm so thankful to be on your show, and so thankful to, to you for really, really educating people and fighting for our rights.
Well, Dr. Hooker, the feeling is mutual. I can't thank you enough for all the great work you're doing. Thank you, sir. I hope we can talk to you again very soon.